and that's a great feeling.
Yeah.
Like, it's somewhat of an honor to get exhausted because, you know, in the hospital setting, you get very humbled with like how sedentary people are. And I'm never more motivated to go run and like get exhausted than after a shift at the hospital. 'Cause I'm just like, I'm so happy everything like works and
makes you appreciate all
and I
the
can
little
just
things.
book it and
That's real.
get out of breath and like and sit with it and enjoy like being out of breath, because some people experience that very quickly. And
a new beginning with R&B, the podcast, the new beginning with Russ and Blake. Yeah, another episode for you with a guest. We're blessed.
There it is.
All right, welcome to R&B Podcast. It's episode 51.
Mm-hmm.
Nice, pushing towards 100. Got to thank God for this opportunity. Thank my boy Russ for being a part of this, and thank Rhythm and Balance for this beautiful production. Thank Elevate Personal Training LLC for leading this world into a healthier space and being a positive light through health and nutrition coaching. And I thank our guest for joining us today. A longtime friend of mine. I didn't realize how long it's been since I've been connected with this buddy, but he's someone whose energy has always been at a high frequency, and never seen him show animosity towards anyone. And that has clearly been a reason why he's led into profession of service and being a doctor of physical therapy. So welcome, Dr. Sean Anderson.
thank you.
Appreciate you, buddy.
Appreciate that.
Yeah, thanks
Very
for being
kind.
here. Mm-hmm. And he's a supporter of the pod, a consumer, some would say. So he knows what we're about here, and it's all good vibes.
It's been good following you and listening to it. I love it. Yeah.
And
big fan.
Were you always on the track to physical therapy, or you started with something else?
No, I pretty much determined when I was like 17.
Okay.
Well, my mom, she was like, "Oh, you're really interested in like exercise? Like, you should look into physical therapy." And then I kind of ran with it. Yeah. I think you were very similar with nursing, right? Like you had family members that were nurses.
Yeah, in a way. You know, I jumped between wanting to be a doctor, wanting to be a nurse, wanting to be an engineer.
Engineer. Definitely.
The science and the human body just always fascinated me.
Yeah,
so
likewise.
Yeah.
Because we met in Anatomy and Phys 2. I think was like, we might have met before that, but that was when we like really started hanging out. Yeah. We had that class together. Mm-hmm.
And we were able to connect over the fact that class was specifically more about the systems and concepts more so than just like anatomical points and insertion, origin, and
muscles.
The memorization part, right? You get to put it all together. And so that's why we've been able to have certain conversations that not everyone can have, because we like to look at the big picture and put things in the context.
Yeah. That is really your first like class where you dive into that. It's really cool. Yeah.
Mm-hmm. Throwing back, because we were what, like 19 maybe?
Yeah, I think 19.
Maybe.
Because I think our freshman year was like 2014, 2015. So I was thinking about that on my way over here, and I was like, oh, dang, it's like almost 10 years since we first met. And that's crazy. You guys, it's even longer.
Yeah, not too much longer. We were like, what, 16 years?
Yeah.
16
Is it high school
years?
for you guys?
Middle school.
We were about 12 years old when we met.
Yeah. Crazy.
Oh, yeah, you did post that photo. You guys are
the
so
Super Bowl. The NFL experience at the Super Bowl.
Right.
That's so funny.
Origin story. Mm-hmm. So you working in physical therapy, you're going on your third year of practice?
Just past my second year.
Just past your second year, going on 3. Nice. Yeah. And so one thing that you've experienced in your practice is going to be similar to mine, in that a lot of the people that we're working with have to deal with pain of various sorts. Yeah. And the management of that pain and trying to stay mobile and trying to stay mentally strong as well can be very difficult. So I was excited that you brought that up as a topic for us to discuss today, because I think at first glance, pain might not seem as intricate as it really is. So
it's very intricate, complex.
Yeah, we're going to get into that a little bit. Now, what do you see pain as or I'll rephrase this. Why do you think pain is significant in terms of someone's overall well-being?
Interesting. Probably because it's like perceived as this really bad thing. And so like it's not favorable. Like being in pain is not something most people seek out. Right. So it's like a very negative experience for a lot of people, I think. And it can be quite overwhelming, which prior to my experience in the field, like I didn't realize how overwhelming it can be. Luckily in my own life, I haven't like experienced it to that degree. But I think, yeah, it's just a very overwhelming negative experience that encompasses so many different systems when you really look at it. You know, and that kind of that knowledge comes from asking the question, like, what is pain? That's a hard question to answer. We kind of talked about that before.
Like, yeah, because it's so subjective. It kind of stuck out to me, the fact that you said it can be unenjoyable or undesirable. I didn't really think about like masochists and people of that nature, you know, that really kind of thrive off pain.
Seek it out.
Or even being able to endure the pain can just be something people like as a challenge in their life.
True, yeah.
Is there any way for pain to be objective? Is there any like scale or device?
It's really hard because, you know, it's kind of fun to play that experiment. It's like, all right, like, how do we measure pain? Like, you can take brain imaging and it's like, oh, everything lights up. Like, you know, certain centers more than others, but like everything's kind of involved. So brain imaging's kind of like, it just shows that there's activity or not activity. It doesn't really like tell us anything more than that. I mean, definitely like where it's located and stuff like that. But then it's just like, yeah, like how do you measure it? How do you get objective about it? And like the best we got is like rate your pain 1 to 10.
Right.
Or you were saying in nursing, you guys use the
Wong-Baker faces. So yeah, I mentioned that to Sean. The Wong-Baker face scale is basically, I think, 5 different types of smiley faces. And then what a lot of people see it as we're supposed to look at these different faces and then determine what the patient appears as. But the correct way to use the tool, which I've seen many people not use it correctly, is
me included.
Right.
I was misunderstood.
Which, yeah, like I said, it's very common to think that we are supposed to decide what the face looks like, but the person in pain is supposed to determine how they identify. So that face that they see, is that how much pain I think that I'm feeling? And instead of trying to put a numerical value on it. So even that example, no way it can be very accurate. There's limited options. There's no detail behind it. So then that's when you ask the other questions, right? Very simple. But we need that because everybody experiences pain. So it can't be something too complex. Because even sometimes asking someone to rate their pain from 0 to 10 is a very complex question for them. And they're like, what do you mean? I'm like, well, like 10's the worst pain ever. You broke your arm and you want to pass out. Like 0, I've flicked you as lightly as I possibly can.
Yeah, but being flicked for some people is like a little toddler.
Right. Right. I mean, and some adults are very sensitive to small stimuli like that, right? Yeah. So, you know, in the hospital setting, I run into situations where the assessment can't be consistent from person to person. And one patient is in the hospital for a week, they might have 20 different nurses. So there's all of these different interpretations, and we're all documenting it, trying to be on the same page, and we communicate and tell how much the patient is needed a certain amount of time, what medication that we're deciding to use with what's available, but there's no way for it to be truly consistent, which is something that, you know, I've had a problem with at times because especially you get family members involved and nobody wants the patient to be in pain, but we can't over medicate them because that will bring a whole laundry list of other problems into the picture. But at the same time, controlling that pain is really important in terms of healing, both physically and mentally. And the mobility portion is very important because people don't understand that you being sedentary is most likely going to exacerbate these symptoms of pain because you're not mobilizing these inflammatory factors, and you're not able to optimize the oxygen transport to that area to promote healing and things of that nature, right? Yeah. So so mobility is really just the key to life. I tell people the more you slow down and the less you utilize your body, the closer you are to being a corpse in the ground, right?
I say the same thing, yeah.
Yeah.
Like, you know, when you work with the older people, they're like, oh, like, I just want to lay in bed today.
Yeah.
Like, you're 86.
Yeah.
Like, you're not getting out of bed.
They talk about their limitations and the lack of energy, and really they weren't limited until they stopped doing these activities.
Right. Have you found any ways that you can motivate an 86-year-old that doesn't want to get up? Like, I don't even know what you would be able to tell me. Like,
just be kind.
Yeah.
You know, reassuring that, like, this will help and they will feel better. You know, there's very few encounters once you actually participate in the medical field and you listen to patients that, like, people are very encouraging. I don't know if you ran into that, but it's like it's a hard field. You see a lot of negative things. So I think, you know, you can just be encouraging to people and not like negative Nancy and like, oh, your knees are shot. Like, that doesn't make anybody feel good.
Right.
You know? But you're like, yeah, like, let's see how you do, you know? And I think we have an advantage in physical therapy that, like, you can, you know, exercise with people and actually do, you know, activities and show them, you know, the extent of their pain, right? Because I've had so many people come in that are like, yeah, my knees just like hurt all the time. And then, you know, like, I take them through like a fitness screen and, you know, they're squatting, they're lunging. And it's like, you did all that fine. Like, awesome. Like, not that bad. Like, you can do a lot. And I think that right there, like, that experience alone, having a professional kind of like show you the extent of which you're capable, like, that's very empowering.
Yeah.
So maybe that approach would like, I mean, it doesn't look like lunges with 86-year-olds very often. Although you get the rare one that's like, oh, nice.
There's modifications, right?
Yeah, absolutely.
So I like to throw people on a TRX band. Do reverse lunges and things. Yeah. And that's why when people tell me they can't do something, I'm like, you might not be able to do it in the way that you're envisioning, but there is a way we can do this, right?
Yeah. And then educating them on like, I almost always start people on box squats rather than like full body weight squats, just because it's such a comfortable variation. And so people are like, oh, I don't squat. I was like, yeah, but you stand up from a chair. Like,
and you get on the toilet.
You get on the toilet, yeah.
That's mine.
Better, yeah. And those are low.
Exactly.
That's a low squat. So, yeah.
I've always had a, you know, really deep appreciation for physical therapists. When I work in the hospital, they're always in a positive mood. I can think of a lot of specialists, nurses, doctors, really any profession where there's people within that industry that I might not necessarily agree with or approve of. But all of the physical therapists that I've met have aligned with me as far as like their energy and their priorities. And I know that there's some physical therapists out there that probably doesn't align, but it hasn't happened yet. And I know quite a few. It is interesting to me. And I think that there's a gratitude from being capable. You guys are trying to help people understand their potential and reassuring them that whatever injury or surgery they're trying to overcome, like, your body is all that you need to push through. And really the mental support that you provide along with the education, I think, is very empowering for a physical therapist. And then seeing that translate into like the patient having that kind of realization and aha moment, I think that cycle is kind of fueling physical therapists to lead with positivity very frequently.
I think we definitely have our advantage being rooted in like exercise. It's an easy thing to root for. Most people feel good when they get their heart rate up,
right?
Like, just naturally. So you come off feeling really good. And we also have a lot of like modalities in our toolbox to help, like the manual therapies. So like massage, the Theragun, things like that. Joint mobilizations, which I guess most people probably aren't familiar with, but just helping people stretch out, move their joints, things like that. Like, that feels good most of the time. And so you know, it's it's very rare, I would say, that people like leave our sessions feeling worse.
Mm-hmm.
And maybe not until the very end. You know, if I've done a good job, we're actually like pushing them to discomfort.
Mm-hmm.
But then by that time, I've kind of, you know, got them mentally ready to be like, yeah, like this is good. Like feel what it's like to be exhausted. And that's a great feeling.
Yeah.
Like, it's somewhat of an honor to get exhausted because, you know, in the hospital setting, you get very humbled with like how sedentary people are. And I'm never more motivated to go run and like get exhausted than after a shift at the hospital. I'm so happy everything like works and
makes you appreciate all
and I
the
can
little
just
things.
Book it and
that's real.
Get out of breath and like and sit with it and enjoy like being out of breath, because some people experience that very quickly and I'm lucky to not be that person.
Yeah, I've actually experienced the same thing with the physical therapists I've worked with, like in athletics.
Oh, right.
They always seem to be very positive. And one thing I like is that usually as an athlete, when you have to go see a physical therapist, you know, you've been humbled. Something isn't working as strong as you are used to it working. So now you're with this man or this lady who's helping you like strengthen up these little muscles you're usually very, you know, able to perform well with. And so you're healing. And I feel like when you're healing, anyone who's like in your corner becomes like close to you, and you guys like kind of have a bond. So that's one thing that I've always appreciated. Do you ever work with any like athletes that have hurt different parts of their body?
Yeah, we work with athletes in my current setting because I do both outpatient orthopedics and inpatient. So maybe like 2 or 3 times a month I do like a weekend shift at a hospital, like a level 1 trauma center. Where people are going in the emergency room, and then we see them on the other side of that. And then during the week, I do outpatient orthopedics, which is more what you would expect, like working with athletes, post-op, things like that. But yeah, worked with a few athletes, and I think if you're open enough, you can see that everybody is an athlete. And a lot of physical therapists, especially from the Institute of Clinical Excellence, shout out Jeff Moore, they're coining the term a fitness athlete. So it's like, like life is my sport and fitness is the thing I'm training for. And so I really like that, like the fitness athlete. And then you think it's like, well, you know, every little challenge, like you can kind of frame it in like the athletic sense. You know, like athletes are very driven to like win. It's like, well, what's this person's win? You know, like sometimes it's things that I'm like, wow, I had someone recently just be like, I just want to bowl. And I was like, I'm not a big bowler and it's not really an athletic sport, but let's get your elbow good.
Right. Or let's get your hip right so you can play it right.
Yes.
I love that, because I always like to remind everyone that I speak with that I'm a student of life. So whether I sound like I know a lot about a topic, I'm always looking to learn more. And in the same way, used to be a athlete in football and track, but I still treat myself as an athlete. And then being a life fitness athlete is a lot different from being a football athlete,
right? Different
or like
goals,
a professional weightlifter. So I've had to really adjust my mindset and my approach to my training, because when you are a fitness athlete and you're training for longevity, you really have to prioritize the recovery and the care aspect and be a little more comprehensive in your approach. And I've dealt with injuries. I have to give a shout out to Dr. Amy that Sean currently works with, and Nick Howe Health, because I had a very difficult mental transition, having the injury that first led me to Dr. Amy. She has helped me with like three pretty big injuries. I tore my bicep in 2020, and I was very fearful of going back to activity because of the pain, and I didn't want to re-injure it. And I'd had problems in the past of re-injuring things, trying to go back too soon. And she really helped me push myself safely so that I could recover as quickly as possible and also get back up to the strength that I had previously been at, which I had just assumed that wouldn't happen. I didn't think that it was possible for me to regenerate myself in that way. But the protocol that she gave me and the reassurance, and she would kind of check in and be like, well, if it doesn't hurt, then you're okay. And I'm like, well, but what if? And she's like, no, don't worry. Like, because that mental piece is so important too. And physical therapists are able to help people get in the proper mental space so that you're not moving fearfully, because a lot of times that fearful, cautious movement is what makes us tweak things even more so, rather than us
like a guarded behavior.
Yeah. We talk about in football all the time. Somebody that's afraid to hit is going to get themselves and the other person hurt.
Yeah.
But when you're hitting with proper form, you're less likely to have an injury or a bad collision that way. And my bicep tear, I think so it was the same year that I got married. I know I had no pain, no immobility within 3 months. And then within 6 months, I was just as strong as I was before. And
that was non-operative, right?
Right, non-operative.
Yeah.
So it was like a grade 1 or 2 rupture of the proximal biceps tendon.
Sounds right.
Yeah. And jacked up my shoulder, and same thing. It's like, wow, pull-ups feel awful, push-ups feel awful. Now I don't even think about it anymore.
Yeah.
But I've had injuries in the past that I tried to manage myself, and not having the proper protocol and not having someone to reassure you and guide you can make that process sometimes never end, right? Some people deal with an injury their whole life just because they didn't have the correct guidance.
Yeah, it's not uncommon that you talk to people and it's like, when did your pain start? And they're like, well, 30 years ago.
Yeah.
It's like, 30 years ago? It's a long time to be dealing with something.
And you listen to the rest of their life and you're like, wow, this is like plagued your activity and your mood and your energy, right?
You were touching on like the cognitive component, right? Like the mental. And that's just a testament of how complex pain is. And only recently has like the model of pain started to expand into that, and like creating, like the literature creating words and definitions that align with that idea, and things like central sensitization is like somewhat of a new thing. The sensitization of the central nervous system, which is your brain and spinal cord, so it's like your mind. And, so it's really interesting to hear you touch on that as someone who has anatomy and physiology background in medicine. It's like, even you're susceptible to like those fearful thoughts creeping in, like, man, I'm damaged for life. And so, it's tricky to work around those things, and it's good to have someone in your corner. And I always advocate for having a coach of some sort for what you do, like even with my hobby, like guitar, like I take lessons, just having someone look at what you're doing from an outside perspective, and especially from a point of like more knowledge. It's just really helpful no matter what you're doing. Always good.
Yeah, we talk about that quite a bit on here.
Yeah.
Coaching your sport and your hobby and your profession.
I'm wondering, the people who have pain for 30 years and then finally seek out the help, is it usually because that pain has made it to where they like can't move, or they just have too many limitations now? That's why they come look for help?
It's complex. Yeah. Like you have to, and this is a very interesting like topic to dive into, but the behaviors around pain and like they may have had an injury 30 years ago, and then if they don't rehab it and they don't like get back to doing things, it doesn't really get better, and you start to have fear avoidance behaviors. So you start to avoid things due to fear.
Compensate.
You compensate, you see a wide range of behaviors around that. And so it's really hard to predict who's likely to be that person. But I know recently I heard that it's like if you, like, let's say you have an injury and you're out of work, like if you cross 2 years of not going back to work due to your injury, like the likelihood of you getting back is like close to zero. And so you really start to go into like the individual's experience, and it's like what happens in that 2 years that then like their odds of ever going back to work are that low. And it's kind of easy to imagine, like, especially it's hard when work is involved in your pain, because then you have to figure that like they're not allowing themselves the space to heal and like to relax, because they're like trying to make money and support their family. So then that just complicates things, and the stress of not being able to do that is arguably like some of the highest stress you can face, like work, money, financial stress.
Yeah.
And so then that gets tied into the cognitive aspects of their pain, right? So now it's like this stupid back pain is keeping me from like being the person I want to be. And now it just kind of like grows. And you talk to some of these people and it's like, it's almost like a part of their personality.
Yeah. They identify with it.
And that's the central sensitization component, right? Like their central nervous system has become involved in the pain. Because, you know, we're taught in school, there's like certain biological timelines that we all kind of, you know, learn. Like, oh, soft tissue, 5 to 6 weeks and it's healed. Bone, 8 weeks up to like, you know, 2 or 3 months. You know, ligaments, however long. And so you figure after 6 months, most tissue is like healed and at least, you know, in the phase of, you know, proliferation, whatever you want to say, rebuilding and, you know, it's back to having integrity again, whatever. So then it begs the question, like after 6 months, like what is that? And I think it's actually after 3 months now, it's considered chronic pain, which is like kind of, we don't really know why you're still in pain. That fracture is healed. That muscle is, you know, should be healed and you're still having pain. And that's where the interest in the central sensitization comes into play. It's fascinating stuff though.
Yeah.
And learning about this helps people in pain. There's research to show that like learning pain science helps people cope with pain. So we get good at like teaching people about it and poking holes in their
awareness,
their thinking. The awareness. You guys talk a lot about that. And I think meditation, which you guys talk about a lot, is very fascinating in the realm of pain. You know, mindfulness and things like that plays a huge part.
A lot of times we try to distract ourselves and ignore it and not address the pain. Whereas if you are with the pain and like we talk about being with the darkness, be with that negative thing that is just in the back of your head that you're trying not to let manifest. Sometimes it just takes 10 minutes of really focusing on it and trying to overcome it that will really lead you towards being victorious in that effort, right?
Basically what I'm thinking is before people knew about how much pain others were in for similar circumstances, I wonder if they felt as much pain. You know what I mean? Like if they didn't have another person to feel the pain, I wonder if they felt as much pain.
That's interesting.
We would have no idea.
You might have a little like, you know, you get hit by an arrow and you're like, oh, that wasn't too bad. And you see your buddy get hit and he's like, ah, and you're like, oh, and then that makes it worse.
Exactly.
I would imagine.
Exactly. Because they talk about like how babies will watch their moms for like the reaction to a rat or something. And it's like, how am I supposed to react to this thing?
How much of it is learned.
How much more pain is learned.
You have to be careful though, navigating that. Sorry to.
I was going to say, even when a baby falls and they kind of pause for a second and look for a response and how they're supposed to react, the same thing.
What were you going to say?
I was just saying it's hard to navigate those conversations with people who are in pain because there's like a little bit of dismissiveness, you know, like, are you in as much pain as you say you're in? And you have to tread lightly with that. And so you have to be like, I believe you're in pain. And I'm still learning to do it. It's very tricky. I've had a few people where I've kind of challenged their thinking, you know, especially like if you're younger than like 30 and you went to a provider that showed you imaging and is like, look at how messed up this thing is. And then you're seeing me 2 or 3 years later and you're like, yeah, I've got a bad elbow. And you're under 30. I'm like, what do you mean a bad elbow? And then you start kind of like having that conversation with them. And if you move too quickly, you can offend them. And I try not to do that.
Because again, they identify with it.
It's like, that's the reason I never win the turkey bowl with my buddies is this bad elbow, you know, like this is the reason I can't perform. It's like a crutch in that sense. And, you know, it's just fascinating how that comes about.
Yeah, it is.
Yeah. Like you said, you never want to dismiss someone's pain.
But you want to challenge them to like be a little resilient in that moment.
Yeah, I'm trying.
Because like I just the big one I can think of is like people who say they have a bad back. It's like the first step
that's
is
so
like,
vague.
It's like, yeah, like, what do you mean by that?
Yeah.
Like, oh, your back hurts when
your
you
back
lift?
is huge. There's so many different spots and bones and muscles and joints. And
I've always been under the impression that if I didn't like stretch frequently, that my knees and lower back would just be in the most amount of pain. Like, I don't even know why I believe that, but I just think that. I don't know. And would that be true if I ran 3-4 times a week, jogged and lifted, and I never stretched? Like, would I for sure be in a whole bunch of pain, or would I probably be able to?
There's no for sure in bodies.
I would just depend on how much you're lifting.
Yeah, true.
In what way. Stretching is good though. You're definitely not going to hurt yourself stretching.
Yeah.
Right.
And I work with some people. It's like I'll have them do like a stretch, and I'm like, this hurts, and I'm like, walking into
because your muscles tight.
Yeah, but I was like, walking into this room is harder than this stretch, so it's like there's a little bit of a discrepancy between their pain levels right there. True. And you start looking for those things, you find them and kindly point them out, and then they'll be like, huh, you're right, like I did just climb stairs to get in here, but now it hurts more but that's not everybody. I do want to preface this and say, like, the cognitive side is more common in the spine and less common in like the periphery, so like the axial skeleton. And so like the farther away you are from the spine, the more likely it is that your pain is going to be more accurate to your input. Perception. Yeah. So like if you twist your ankle, like it's very rare that someone has like like chronic ankle pain, and usually it presents as like chronic instability, which is like they're just not as strong or things like that. But very rarely is not nearly as common as the spine, like the neck or the low back.
Yeah. And then people carry so much stress in their neck and shoulders that a lot of times it is that mental aspect. If you get to the root cause of all this stress, and then they are more relaxed overall and don't have all this tension, then sometimes that's all they need for their neck to feel a lot better too.
And that kind of touches on too, like helping people define their pain, because there's like different qualities, like sometimes when people come in, and I actually kind of got this from doing therapy, where they're like, oh, you're angry, like that's doing yourself a disservice. Like you're frustrated because your expectations aren't met. Like that allows you to look at it and be like, wow, like I'm frustrated because of this. And then, but if you're just angry, like there's such a like broad, vague, so like if you just say I'm in pain, it's like, well, what are you feeling? It's like, well, my back is stiff when I wake up. And it's like, okay, like, that's not pain. Like welcome to like being active and like stressing your body. Like you wake up stiff, and here's what you can do about it. Or I feel a pinch when I do this, and it's like, okay, well, try it this way. It's like, oh, it doesn't pinch anymore. It's like, oh, great, like you're not in pain, things like that. So like really that can go both ways though. Like if someone is overly fixated on their pain, that can backfire. But if they're not paying attention enough, then that can be like a good practice. I think that's interesting.
Sometimes people will perform an exercise and then afterwards they're like, I don't know, that really hurt. I was like, oh, it didn't look like it hurt. And you waited until afterwards to tell me. So like do a couple more and then tell me where it hurts and how much it hurts. And then when you get the details, you're like, oh, well, it's probably because your form was off, or your core wasn't engaged, or you're putting too much effort in that shoulder rather than trying to drive, and utilize the rest of your muscles. And so the body mechanics are very important. And a lot of people aren't aware of how their body works. So once you point out to them like, hey, you're walking very improperly, your gait is the reason that your knees and your hips are hurting. And it's probably an imbalance, but we're going to get you strong and fix it up. And you lay it out for them, and sometimes it seems too good to be true to them. They're like, there's no way it's that easy.
And you're like, it's not. It takes practice. You got to. Right. I think that's the biggest hurdle, that like exercise as an intervention. Because I think about this a lot, because, we always say like there's no, or there's like a side effect to everything. And like medications, obviously the side effect is on the label. There's like different things that it affects. And then for a long time, we tried to like sell physical therapy as this like non-side effect thing. But I really do think the side effect is the time and effort that goes into it. Like to be a healthy individual, meeting those like minimum criteria, 150 minutes of aerobic exercise a week, at minimum 2 lifting sessions at like 60 to 80% effort. Like that's hard for a lot of people to achieve, and it's like unattainable. So it's like, yeah, there's a downside to exercise, and it's the effort and the
commitment,
time commitment. It's a lot. I mean, I currently try to go to the gym like 3 or 4 times a week, and that's tough. Working and doing that.
Yeah. Sometimes we just have to be a little more creative with what our exercise looks like.
Yeah, workout snacks, right?
Yeah, workout snacks, exercise snacks, movement snacks, whatever. Like for me today, hit a few sets of push-ups, knew I had a bunch of stuff to do on the computer. I was going to be here to record, and I was like, I don't have time to go to the gym for an hour, especially because I slept in a little bit. And you make it work. I maybe am not going to burn the 600 calories that I typically burn, but I've already put my body to work, and I will make sure that I eat properly today to kind of offset things a little bit and not have my high caloric intake that I might have on days that I'm lifting really heavy, and just explain to people that sometimes you just got to navigate through life a little smoother and not make these roadblocks bring you to a stop, but realize that maybe you just need to take a turn and go around it and make it work in your favor. And I try to be understanding because, I'm a husband, I'm a father, I have my professional endeavors, so I understand that time is valuable, but time is also a social construct. So how we use our time is within our power. You can get up an hour earlier if you need to. You can go to sleep an hour earlier if you need to. I think a lot of us have so many things we can cut out of our day that really aren't contributing to our lives as much as we may think it is.
And I also think it's not always like so apparent that we don't want pain. You know what I mean? Like sometimes we do seek out problems and we seek out some pain.
Yeah. Less than the physical pain, but more so like the emotional pain that someone might experience.
Definitely, like within our relationships, like within all these different things. Sometimes it adds excitement into people's lives, and
which can manifest in physical pain. I definitely believe in that. And you're familiar with Tony Robbins?
Yeah, the motivational speaker guy.
Yeah. And it's funny you say that because I've been just recently been like, I didn't know that he had anything to his name beyond being a motivational speaker until recently.
Business guru.
Yes.
Kind of all-in-one.
Kind of an all-in-one guy, but he has some pretty extensive knowledge of like pain management and regenerative medicine just because of his own experiences. So, he had a pituitary tumor at one point in his life. And that's why he's so tall and large. And so his book Life Force, if you haven't read that, I think that you would like that a lot. He talks about how he managed that non-pharmacologically, and how he managed his degenerative disc disease through like stem cells and things of that nature.
He had a pituitary tumor that he didn't like treat.
Yeah, so it wasn't causing him any negative symptoms.
So it was benign, just...
Right, but it was secreting a lot of growth hormones still. So his rapid growth led his doctor to inquire whether or not he had this tumor.
Yeah.
Because it made sense, wild. Right? And then so on images, they're like, yeah, you have this tumor, we need to take it out. And he was like, whoa. Like, I know I'm growing really fast, but I don't have like any other... negative effects from this, so like can we just slow down and see if like my lifestyle management or anything is gonna change the growth of this or anything. And so I would look into that.
That's
book.
Interesting. Yeah, cancer is one of those things, at least in physical therapy, that it's like, you're kind of exercise yourself out of that. Like you need to go see a professional that is gonna work on chemotherapy or potentially.
He talks a lot about the diet and supplementation that can be used in conjunction with those. And I think that is often overlooked because I know even me have taken care of cancer patients, and we have so much sympathy and empathy that we just want them to be comfortable and like, oh, you can eat what you want, and like, oh, like this is that going to make you feel better? But really, we need to be telling them like you need to avoid those sugary drinks and all the like bad food options because it's going to give your body more of an opportunity to, one, fight through the chemotherapy, and then two, also to not feed this tumor. So yeah, that's one little cool tidbit that I think you would like from that book, Life Force. But then also, have you heard of pulsed electromagnetic frequencies?
Post electromagnetic frequencies.
Pulsed, Pulsed.
Pulsed?
Yeah, pulse.
Maybe under a different title. Is it like ultrasound?
It's literally like they call it electricity, lightning in a bottle almost, because it sends these small frequencies that aren't going to be like a strong enough impulse to make you feel like you're being electrocuted or something. But I'm a firm believer in like the whole world being kind of attracted with this magnetic interaction.
All frequencies.
We're all frequencies, right? So our thoughts are frequencies, and then our energy is frequencies, and a lot of these manifestations within our bodies are also frequencies. So that's kind of like oh gosh, you used the term that's not secular.
Oh, yeah.
A little bit of a secular approach. I've actually invested in a small device that is supposed to stimulate these frequencies and eliminate pain, but also get you to in a certain frequency to whether you want to focus or relax or something of that nature, similar to like binaural beats, but again, taking control of that kind of magnetic field.
What's like, how do you obtain the frequency? Like, is it like a patch you put on your body?
It's a device. It
just sits next to you.
So the one that I got is kind of like a horseshoe shape, and you can like either put it on your neck or throw it over your shoulder, over your knee. And
you have to let me know how it goes.
Yeah, I will, because there's an app connected to it, so you can kind of choose what frequency you want to be in. And
I'm not too familiar with that. I know that there's definitely something to be said about your like sensory inputs and then your motor outputs. So for example, like if you're listening to higher like upbeat music, people tend to like obtain a higher heart rate than if you have them listen to a lower music or you know, like just getting yelled at, get your butt in the gear,
kind of stimulate
that. So there's definitely like something to be said about that. I've never heard of that though. That'd be interesting. You'll have to let me know what you think.
Yeah, I will.
And a lot of those things too, I kind of, when I like navigate it in the clinic, I tell people, I'm like, if you think it's working, like
exactly,
go for it. Like, I think we like discredit placebo a lot, but it's like, you're like trying to fight the constant battle of negativity and not getting out of bed every day. And if it's like the only reason you get out of bed is because you put this thing on your neck and turn it on your phone, like do it. Yeah. Like let's start there. And that's not, like if it works for people,
I agree.
I'm open to it.
Yeah. What do you say to like patients that want to use medical marijuana for like pain tolerance? Yeah,
I try to navigate this stuff because like, you know, the pharmaceutical side is very much out of our scope of practice. We know what medications are and how they interact with exercise and things. So the angle that I take with people is, you know, just be aware that medical marijuana can spike your heart rate, increase anxiety. So if you have a heart condition and you smoke a bunch of pot before you work out, like that can be problematic. Or if you're already anxious to go to the gym, and that's probably not going to help. If you get your blaze before the gym. But, you know, like we had one patient that she swore by gummies, you know, and it's one of those things that if it helps. You know? Now, there's a hierarchy of like things. Like first and foremost, you have to exercise and you have to eat well and you have to sleep well. Like those kind of have the biggest effect on people. And then like below that, you know, like smoking a joint for your workout, sure, that could be in there. But like, you know, the difference between smoking and not smoking is less important than the difference between getting a good night's sleep and not sleeping. That's the point I'm trying to make, is there's like a hierarchy of like,
as long as it's not interfering with the other things.
But I mean, if it's legal in your state, do what you want.
That's a good way to put that, like to know the hierarchy of that.
It's important.
I think that's, you get a lot of questions from people very inquisitive patients that'll like, they tend to be very, I'm like talking a lot during their sessions, and they're like, should I eat, at 7:00 or wait till the next day? And it's like, well, like first and foremost, what are you eating?
Right.
Like that's more important than what time you're eating.
Yep.
And so, a lot of those kind of nuanced questions, it's always like, are you checking the basic boxes? Because then you can start worrying about what time you're eating. It's like, let's just make sure you're eating good food first. And then we can talk. But I also don't really get too much into that in the clinic either, because again, I'm not a dietitian. So.
But it plays a role, so it just comes up.
Yeah, it does come up, and I try to be respectful to my colleagues that know way more about that than myself. And when I see someone who's really requiring that, referring out to them. But that's usually the point I try to make is like, what are you eating first versus what time or how fast? Or
I'm glad you said that too, because I get clients of mine that know I have this knowledge of anatomy and injury prevention and healing, and I'm like, well, when it comes down to, if you're having that many problems, you need to go see Dr. Amy. That's who I refer all my people to, because like she fixed me up, and that's not my wheelhouse, and Dr. Amy's great at that. So paying respect to your colleagues and not trying to act like you got the superhero cape and have all the answers, right?
And just being humble, and like in the same way that like if I'm working with someone and they don't have a whole lot of pain and they're looking for more of that personal training, it's like go see Blake.
And then the placebo thing's big, because I am a placebo advocate. I'll say that I love if something doesn't have a real effect on my body and all of a sudden I feel better. What's wrong with that?
Well, have you heard of the counterpart, nocebo?
Oh, because you can think yourself out of something working that's actually effective.
That's they talk about it in our field, because like certain interventions, people are like, oh, it's placebo, and that just means that like compared to a control group, it didn't do like that much better,
right?
To confidently say that like had a tremendous effect. And so nocebo is also the same thing, where if you tell someone like this isn't going to work, like that, that they're less likely to reap benefits from it.
Yeah, that makes sense.
And so when you think about that in your interactions with people, you can nocebo them into like, you see this a lot when people go get imaging, right? They look and they're like, oh, you have the worst arthritis I've ever seen. Like, you'll never walk again.
Yeah.
Nocebo. Like, that is dooming that person.
Yeah.
Whether, like, nothing changed. They walked into your office. Like, maybe their pain wasn't that bad, but you can make their pain worse by, like, nocebo.
Yeah.
But also on the flip side, you can be like, sure, you got some normal changes with age. I'm sure if you strengthen your muscles, you'll be fine. They're like, oh, great. Same person, same encounter, two different outcomes based on nocebo or placebo. So in that regard, it's like, you got to give people everything that they can to win, And so, a lot of people I think are anti-placebo, and they're very objective, but it's like, you got to be a little bit more realistic. Like,
and give people options, because there's no harm in somebody, unless it's going to take away from the efficacy of the I guess protocol that we know is going to work, right? If it's something to add on that could potentially make them feel better or make them feel more positive about the situation, then I think it's more of a pride thing sometimes when people have that nocebo, because they know the answer in their head and they don't want there to be any other option.
Yeah.
But with medicine and with our bodies, there's usually multiple routes that you can take to get your desired outcome.
Definitely, yeah.
Yeah.
It's challenging though. There's a lot of different routes, and matching people to those, is not perfect science. Right. And
sometimes it's trial and error.
Yeah, and we're not doing very well in the Western world, unfortunately.
No, but I tell Russ I have a lot of optimism moving forward, just with how technology is going, and with artificial intelligence. I think sooner rather than later, all of us healthcare providers, clinicians will have to integrate these artificial intelligence I guess, applications into our practice, because when it comes down to it, they are able to process information much better, do research much more efficiently, and take the subjective piece out of that decision making. So not ever being replaced by artificial intelligence in this setting, or I guess I won't say ever, but anytime in the foreseeable future as far as replacement, but rather using it as a tool.
Yeah.
Right. And so I don't really understand why there isn't more of a, I think, open effort to that. I know a lot of organizations and people kind of behind closed doors working on these things, but even just educating the public as far as doing certain research using things like ChatGPT, I think would be very effective. Yeah. I still have people reach out to me asking very simple questions that I know the answer to in my head, but I'll use ChatGPT to give them a more structured answer because it's more effective that way to me.
You're using AI a lot, huh?
I use AI quite a bit, and some people think it's cheating. Some people think that it's taking away from the individual. Yeah. But when I use AI, when you prompt it properly and give it all of your thoughts and your emotion behind it, it's really good at helping you articulate thoughts or helping you organize or leading you towards resources and things of that nature. So like I say, it's a tool. And I think that it's a tool that we all have to use if we want to be successful in our respective industries, whether we like it or not. And it's very early in these process, and it's not always consistent in the output. So you do have to use your discernment and not just take it for what it is off of that first response, but it's pretty easy to tailor it down into what you want it to look like also. So it's a great template for basically everything, in my opinion.
You're using it, my guess, just from like following you on social media, like your LinkedIn posts that are like pretty long. I'm sure you like generate some of that.
Yeah. So I usually, I'll put in quite a bit, but the way I think is not always organized. Yeah. So right. So
that rough first draft.
Yeah, but like, if I don't just spit it out and get it on paper, then it's sometimes just a fleeting thought.
Right.
So sometimes I'll have an idea, something like, wow, I think that would actually be kind of powerful. So I'm like just kind of putting that idea into the ether. And then I ask it to organize it for me, and then I can kind of tailor it. And a lot of times I'm like, wow, that sounds exactly how I would make it if I had sat here for another 30 minutes and done it, right?
It's funny you said that, because I had like this long Word doc on my laptop where I was just like journaling for maybe like 4 weeks, and I would just like word vomit. And then just out of curiosity, when ChatGPT first came out, I was like, let me just put my journal in there and have it like reorganize it. And I started picking around, and I was like, this is kind of crazy, like having it analyze your thoughts and then regurgitate it. I was
because I mean,
that's such a good idea.
Again, right? He's like, oh shit,
that's crazy.
It's weird to have it like give you answers based on your like past journal entries. Like, you thought about this a lot. I was like, I didn't even make that connection.
Yeah, and I mean, I think that us as humans, one of the most amazing gifts that we have that sets us apart from the other animals of the world is our ability to collaborate. And so now that we have this artificial intelligence that we can collaborate with, I just really see that as a way for us all to accelerate our productivity and our thinking and our education, right?
Yeah, definitely.
I have a friend who's in athletic training school right now, a former client of mine, and he's like, tell me about his test coming up, origin, insertion, all those things in anatomy. I'm thinking back to when I was trying to remember that. And so I show him ChatGPT. I'm like, ask this what you're confused about and what you're going to be tested on. And then ask it to make a template for you in a study guide, right?
Yeah.
And
I never even thought about like study guides and things.
Oh, yeah.
That's probably good.
And that's the thing. Like people look to the word cheating, like, oh, it's writing an essay for me. It's like, but this is a tool. It can lay out the information for you. It's up to the individual if they want to actually learn the information or just have it laid out so they can use it and never think about it again.
Yeah.
But when it comes down to it, having an opportunity to access information and data quicker and more efficiently, that is all we need to continue to build upon our society. You look at books to ebooks to all these processors and how quickly our methods of input are changing, right?
Mm-hmm.
Like this morning I'm listening to an audiobook and I'm like, wow, I've been reading books 10 times faster than I would if I was sitting there with the text.
Yeah.
I was talking about before, I still think there's a lot of value in sitting there with the text.
Definitely is.
Having that form, but at the same time,
slow yourself down.
You slow yourself down, which is actually very important.
Yeah.
Something that at times is necessary for me, but in the overall picture, when the world is moving exponentially and growing exponentially, sometimes you got to like turn up your notch a little bit too. And if there's all these publications from 40, 50 years ago that are still relevant now that I haven't been exposed to yet, but I want to stay up to date with research as well, that can be a lot. So having these tools to either condense and summarize or help you navigate, I think is extremely valuable. And a lot of people haven't even played with it yet. And a lot of it is fear. But
I'm a bit of a technological conservative myself.
Yeah.
If it comes down to the neural link in my brain, I'll probably hold out.
It's funny because what he mentioned about the electromagnetic pulsing is kind of like the beginning of where Neuralink will go with being able to get people to experience altered states of mind, because that's like that's what they want to be able to.
Right. So
have
instead of being an external, it's an internal.
I don't know if I like that. Like just being able to turn.
I don't know if I like it either, but when it comes down to it, it doesn't matter if we like it or not. It's like these things are happening.
Yeah,
right?
Absolutely. But it's almost, that makes me think like, oh, you're sad, like just Neuralink, and then but that's antidepressants, and we know that like isn't the whole picture. Like I feel like every time that we have some sort of like technology that seems like amazing, when it plays out, it's like, the world is just way more complex. Like that fat burner that like people would take in the 80s, and it ended up like cooking your liver.
Oh gosh,
because it was trying to imitate exercise and like accelerate.
They came out with a recent medication that's supposed to basically be that too.
Ozempic.
No, this one is literally I need to do some research on it actually, because it's actually a medication that's supposed to make your body think that it exercised, not just lose weight,
I'm
but
just
actually
so skeptical of the ability of that to happen.
I am. You're going to be moving out of state here soon. So
right,
I appreciate you dropping by the studio before you embark on your journey. We'll probably have to do a virtual episode next time we get you on here, unless you're
I'll fly back.
You fly? Oh, okay,
Yeah.
okay.
Tickets are cheap. They're like less than $100 from Denver.
We might go out there then. We'll see about it.
That'd be sick.
Have you been out there recently to Denver?
When was the last time I went? I've been like 2 or 3 times in the last 2 years.
Okay.
My wife's there right now looking for housing.
Nice.
That's cool.
Yeah.
Nice. The last time I was there, like every Uber or Lyft driver I had told me to go to Meow Wolf, if you know what that is.
I've been to the one in Las Vegas and the one in Denver.
Okay, that's cool. It's like this like trippy art museum with like cats or something. I didn't go in there, but I don't know.
It's like an interactive art museum. And it like lends itself to the trippy side.
Yeah.
You like walk through. You ever seen Omega Mart? That's like the one in Las Vegas. Like videos of people like opening like a grocery store fridge, and then you walk through and you're in like this like different area. Each one is a little bit different. I'm trying to think. I think the one in Denver is pretty cool.
I'll have to check that out.
Yeah.
Well, all right, Mr.
So hopefully
Dr.
you enjoy
Sean.
traveling there, and have safe travels, and then enjoy your new residency out there. That's cool.
Yeah.
Mm-hmm.
And we appreciate you
Yeah.
for coming on the show. It was a great conversation. Took some turns that were quite pleasant, didn't expect. And thank you for just sharing your background and your knowledge and your congeniality and adding to our space. And thank you for supporting the podcast.
Absolutely.
Dr. Sean is a supporter of the R&B podcast. So if you're listening to this and you like Dr. Sean and you like us, then you need to support this podcast. So please like, share, and subscribe. Whatever platform. We're on YouTube, Spotify, Apple Podcasts, Google Podcasts. We got TikTok, RNB_pod. That's the same as our Instagram. So find us on all these platforms. Mm-hmm. Share it with somebody you love, because we love you. And spreading love is the key to all these things that we want to manifest in this world.
There it is.
What you got?
Like last week, we'll see you next week. Peace.